Hello everyone, I am Dr. Pradeep Kumar K, Senior Consultant and Interventional Cardiologist at Sapthagiri Super Speciality Hospitals, Bengaluru. There is an alarming increase in the incidence of cardiovascular diseases in our country in the recent past. The general feeling is that younger individuals and premenopausal ladies are protected, are immune from cardiovascular diseases, but the recent incidences have shown that this is not at all true. Even younger individuals and premenopausal women are equally susceptible to develop cardiac diseases. Whenever there is a death or an event in a famous person or a celebrity, there is a knee-jerk reaction. All of us are, suddenly we have, there is some enlightenment that we have to get checked up and we get ourselves evaluated for cardiovascular diseases. But once this is over, once the thing settles down, then generally most of the times, most of us, we neglect our health. So there are a few important issues that we would like to address today. Firstly, am I at risk of developing cardiac diseases or heart attack? So this is something which we need to address. Then secondly, how do I prevent it? If there are risk factors, how do I prevent it? So there are some risk factors that are present that can put us at an increased risk of developing heart problems. Firstly, the diet. We are what we eat. So in the recent past, there is increased reliance on high carbohydrate diet and processed food. The kind of food that we choose is not at all healthy. So including pizzas, burgers, and with lot of saturated fat. So all these things are not good for our health and it is not good for our heart. Nextly, physical inactivity and sedentary lifestyle. So previously we used to commute by cycle or we used to do a lot of walking, but these days we rely more on motorcycles and bikes and cars and these kind of mode of transport. So this again puts it at, whenever there is sedentary lifestyle or physical inactivity, this increases the risk of cardiac problems. Thirdly, obesity. So it is told obesity runs in families. This is not true. Obesity happens in families which do not run. So whenever there is physical activity and sedentary lifestyle, so this results in obesity, and obesity forms a platform for a variety of conditions like diabetes, hypertension and cardiac diseases. And next thing is psychological stress. So in a fast-paced world like today, so a lot of us are in psychological stress. This adds on to our risk of cardiovascular diseases. The next thing is, most important factor is smoking, especially in young individuals. Young individuals, most of the times who come with heart attack, the most important risk factor is cigarette smoking. So this has to be avoided as much as possible. The next is, it is told that sitting is the new smoking. So we should not sit for more than half an hour or 45 minutes at a stretch. So this is very important because just sitting for a longer time also increases the risk of cardiovascular diseases. And the next most important thing in the recent past is screen time. So there is something which we carry, which is there with us always for most part of the day. So it is there with us when we sleep, it is there with us in the bathroom, it is there with us in the toilet, it is there with us in the workplace, and that is our mobile. So it has become a habit that we have to keep looking at the screen. It may be television screen, a tab or a mobile. So this is something which we need to minimize, because increased screen time means we are not giving enough time for other things and we are also reducing our sleep. So reduced sleep is also a risk factor for cardiovascular disease. Apart from this, there are other important conditions like diabetes, hypertension. These two conditions also can put us at risk for cardiovascular diseases, and dyslipidemia is one more important condition. So, so these are some of the risk factors which we need to be aware of. The next question is, how do I prevent these risk factors? So when we are aware of the risk factors, we know how to prevent them also. So firstly, we have to be very cautious about the diet that we eat. We have to avoid this kind of high carbohydrate diet and processed food. We have to ensure that we walk for about 40 to 45 minutes on most of the days in a week. And any kind of physical activity, it may be cycling, it may be jogging, it may be brisk walking or aerobic exercises, these things have to be undertaken. Next thing is we have to maintain an ideal body weight. So regular exercise and physical activity and a good diet can help us in a long way to maintain an ideal body weight. Psychological stress, conditioning the mind is important, and regular meditation for at least 10 to 15 minutes and relaxation techniques we have to learn, and we should know how to manage psychological stress. So these are some important things that we can undertake. And the next thing is we have to prevent diabetes as much as possible. If still, because diabetes is multifactorial, it can be genetic predisposition also can precipitate diabetes in us. Apart from that, there are a lot of acquired risk factors which puts us at risk of developing diabetes. So we have to avoid it as much as possible. But if we are diabetic, there is no need to worry. We have to ensure that we have good control of sugar levels. And nextly, hypertension. Controlling hypertension. Hypertension is considered as an iceberg disease. Till we check the blood pressures, we will not know that we are hypertensive, but it is also a silent killer. So if we do not control blood pressures, it is going to cause a lot of complications, including cardiovascular diseases in the long run. So this has to be, so that is the reason why we have to regularly check our blood pressures, and if found high, no need to panic. We need to repeatedly check the blood pressures, and the average value, if it is more than 140/90, we need to get ourselves treated for same. The next important risk factor is the high cholesterol levels or dyslipidemia. So this is, it has been found that some of the studies have found that increased cholesterol levels is one of the most important risk factors for developing cardiovascular diseases, and it predisposes the patient to develop heart attack. So it's important once in a while to get your lipid profiles checked, and if found high, it also has to be adequately treated. So by doing all these, taking all these measures and getting ourselves checked up regularly, that is most important. All these things are not going to happen automatically. Once in a while, we have to get physically, we have to get a medical checkup done. So you have to consult your physician or preferably a cardiologist and get your heart evaluated, and thereby we can prevent a lot of events in the future. Thank you.